Welcome. My name is Dirk Pfeiffer. I'm professor of One Health at City University, and I have the pleasure to introduce this panel discussion under the roadmap series. This is the 8th panel, and we've named our roadmap series Discussions for the Future of Poultry, People and Planet. These fortnightly discussions address key issues for sustainable development from the perspective of nutrition security and the global poultry industry. We aim to contribute to the United Nations call that we build back better from the COVID-19 pandemic for the future we want. We've got a few housekeeping notes. Number one is today's discussion will last 1 hour. We will finish on the dot after 1 hour. The event is being recorded and will be available on the One Health Poultry Hub website. A direct link will be sent to all registered attendees. Please put questions to the panel through the Zoom Q&A function. So the Q&A function is the key here, which you can access at the bottom of your screens. Feel free to vote for questions that you think particularly important. And if English is not your first language, please don't let this stop you from asking questions. I will put as many of your questions as possible to our panelists, but if your questions is covered in a previous answer or we run out of time, please accept my apologies. We have also an online discussion channel you can access from the website and from your registration link. Please explore this to share questions, comments, thoughts, and in fact, these online discussions will contribute to the series of briefing notes we will be preparing from this series of our panel discussions. Today's discussion is on pandemics, models, and their limitations, and the associated scientific, social, political, and ethical challenges. And what I would like to start off with is to actually ask you some questions. We've got a poll here on your screen. It should disappear from the screen once you have voted. I'll give you a few minutes to think about your response, and we'll have a second poll question at the end. So I'm delighted, and I'll have to ask my, let's see, the panelists to turn on their screens, their cameras. I'm delighted to welcome our expert panelists for today. And we have Professor Gabriel Leung, who is Helen and Francis Zimmern Professor in Population Health, the Chair of Public Health Medicine, and the Dean at Hong Kong University Medical School in Hong Kong, Special Administrative Region. We also have Professor Steve Hinchliffe, who is Professor in Human Geography at University of Exeter in UK. And as you can see, we've chosen two experts from quite different areas, and we're excited to see listen to them about their views in relation to the use of models for policy development in particular. Each of the two presenters or discussants will have 10 minutes to present their thoughts. We'll give them a signal at 9 minutes, and they will then have 1 minute to wrap up. So without any further words, I'll hand over now to Gabriel.
Thank you so much, Dirk, for allowing me this opportunity to share with colleagues from around the world and hosted by Chatham House. My role is really just to perhaps explain a little bit what we should and shouldn't expect from so-called model predictions. And the first thing I should say is that prediction is not the only function of models, and in fact, it should only be probably a minority of objectives should concern predictions. Models do a lot more things, and here I try to show you a little bit of what the concept of modeling is. So if you look at this picture of a butterfly, that's reality. And what modeling does is it tries to perhaps approximate reality. And one way of doing that visually is using pixels. Another way is to use contours. And you can see that both try to approximate reality, but they are not quite reality, and they're quite different from each other because they use different methods. Now, if you actually go up, you have greater complexity and therefore greater fidelity to reality, and less model distortion. Whereas if you have a simpler model, you will get much more distortion of reality. Now, sometimes what you get is you have a set of observations, so empirical data, and you get what you see in the middle. And what you try to do is to reconstruct reality from your set of parsimonious observations in real life. And model one gives you that. And then if you refine, and as you refine model one, it gives you this picture. Model two gives you approximately the same thing as model one on the first try, but then if you let it go on until the very end, you wouldn't realize that it gives you a completely different depiction of the supposed reality. Now, if you then take that sort of 35,000 feet view and look at specific application to infectious diseases, one of the first sort of modern modeling exercises was concerning HIV/AIDS. So there was a very, very famous, or rather infamous paper published in JAMA back in 1990, looking at predicting the course of the HIV epidemic. And the authors here used essentially Farr's law. William Farr was a Victorian English scientist, and he basically said if you actually observe epidemics, they always come almost invariably in this bell shape. And essentially, mathematical or statistical, in this case, footwork, would allow you to then draw something like this. If you pay attention to the y-axis and then compare it to reality. This is by Tony Fauci back about 25, 26 years ago. And it's not a modeling paper. It just tells you the first 20-year history of the HIV/AIDS epidemic. And indeed, if you just look at cases and deaths of AIDS, not even HIV, you can see how wrong this initial Farr's law-based model really was. Fast forward to COVID-19, and if you actually look at a couple of papers here, one is from the Johns Hopkins Bloomberg School of Public Health, and the other is by Nick Jewell, published in Annals. Nick Jewell works in Cambridge. So if you actually look at two different models, one is by IHME, or the Institute of Health Metrics and Evaluation in Seattle, headed by Chris Murray, and then the Imperial College London model, headed by Neil Ferguson. If you actually look at their predictions for Italy and New York State, and you look at the training data, the prediction, which is yellow, and then the observed subsequently. So based on the red, they had the yellow, and then the blue is actually reality. You can see what a world of difference, because at least in the beginning, the IHME model was actually very much a Farr's law-based model, and that's why it was quite wrong. Whereas it was a much more nuanced and sophisticated transmission model that Imperial used, and that's why you see that things were actually much more truthful to reality for both Italy as well as New York State. So if you then take a step back and say, hey, you know, what about flu data? And Google flu trends actually had a big boo-boo because it really didn't work very well. As you can see, Google really overestimated the peak by quite a few X's here back in 2013. And then if you actually look at these earlier studies, they were pretty good. But then when the Black Swan event came, didn't really work, which is when you really needed it to work. Similarly, dissections by John Brownstein from Harvard and company in PLOS computational biology, again, sort of tried to look at the circling-based type of CDC model versus the Google flu trends model. Is it really, when we hit the big data age, that we don't need theory anymore? Of course not. Big data just means really, really big garbage in, garbage out, unless you understand and really pay attention to the model structure. And there are a lot of people who have actually spoken or written about it already. Now, this comes to our work, which was actually done in the middle of January last year. It was really to try to answer the question, what might happen if no controls were put in place. This piece of work actually came out in the Lancet in the last week of January last year, predicting that we were going to get a pandemic. And of course we did. But how we did it was really looking at backwards inferring the size of the Wuhan initial cluster by the exported cases to Japan and to Thailand initially, and then using IATA or flight data to backwards infer the initial size of the outbreak, and then which spread to the rest of China in the country domestically through the Spring Festival related travel, which by the way is the largest annual human migration in the world. And what we showed also was in different cities in China, what it could be if no controls were done. And here we showed the blue bars were what actually happened. The red bars were our predictions. And the green bars is just using a different set of definitions for reality. And what you see is actually didn't work very well here in Changsha and Nanchang, as well as Chongqing. And what you find here is that that's because road traffic accounted for a larger proportion of human mobility. And that's why it really didn't work too well in these places, whereas it was actually very close in the rest of the country. As I said, our aim was not to predict precisely how many people were going to get infected, but rather to say, if you do nothing, you're going to get an absolute catastrophic result. Whereas if you reduce transmissibility by at least 50%, you are going to get this kind of result. And indeed, empirically, by the end of March, when you actually look at the Chinese numbers, you can tell that except for the original epicenter of Wuhan, they were able to, through basically a nationwide and within country lockdown between provinces and cities, that they really pushed the transmissibility reduction upwards of 75 or sometimes even 95%. Now, the second piece of work, again, about predictions is in Hong Kong. This came out very, very recently in Nature Communications. And it was really using our octopus card data, which is essentially capturing 95% of all mobility of the local population by various public transport means, and looking at deconvoluting these delay intervals so as to then backwards infer what the RT might become. And to cut a long story short, we found the sort of data stream that is most highly correlated with the RT stream historically, that is based on earlier data from the first quarter of last year. And then we nowcast and forecast it. And as you can see, moving from left to right, actually the nowcasting and the forecasting was pretty good. And that's actually what we relied on to tune our social distancing policies in Hong Kong. Finally, just let me thank key members of the team and also their own teams and our major funders for bringing to reality a lot of this work. Thank you.
Thank you very much, Gabriel. I mean, that was a really good way of introducing the use of models to us. And I'm sure there'll be a good discussion afterwards about the, I guess, where the potential is in taking them further. I mean, I want to start off with one question, and that is because you worked a lot at the policy interface, and in your presentation, you emphasized that these models have limitations, and I just wonder how do you communicate that? I mean, what's your experience there? I mean, how well does that work when you talk to policymakers?
I mean, I think that, in fact, if you go to the BMJ website right now, you will see a whole series on co-producing evidence to inform policy. And we co-authored one of those pieces in there, led by Robert Martin. And it really sort of gives you an account of what we've done. And I think that for my team, it's perhaps because we've had a very long history of working with government. It really goes back all the way to SARS, almost 20 years ago now. And then I myself joined government and actually worked for government and led the government response against the 2009 flu pandemic. And then working across the aisle with university colleagues to use evidence and co-produce evidence for government response. And we basically took those playbooks, both within Hong Kong as well as with the national authorities in Beijing and elsewhere, to co-produce the evidence. And so we really worked really tightly together, and made sure that whatever we have been doing is with a focus on real life impact in mind. And I think that it's not just us. If you look at the SAGE experience and the nerve tag experience in the UK, it's exactly the same thing. And I think that, that's really extremely important in the current pandemic.
Thank you. I mean, so the key really being a relationship that you've developed over quite some time, where there's actually mutual trust and understanding, and the language that you can use with them, where both parties can actually work well together. Now, and I think that's very useful to emphasize. Thank you very much, Gabriel. I mean, we've got in fact, the results from the poll, and it's actually, I mean, I guess it's quite interesting in that people, I mean, the minority of people, they felt they're only useful for research. So most people realize that there's actually a utility or a useful in the policy context. But in terms of the relative importance of these epidemiological models and socioeconomic and ethical issues, it's kind of, I guess people are, the audience is undecided. So I think this is shows actually what has happened over maybe the last year, maybe the couple of years before, where people heard or have seen how these models are being used in a policy context. So let's just see with our next presentation what Steve has to add in that context. So I call on you, Steve. This is your show now. I will turn off.
Hi, thank you very much, Dirk, and thank you, Gabriel, for a fascinating talk. I'm just about to share my screen, and here we go. So my background is different from Gabriel. I guess that's the idea, is there's a synergy here of some kind. I'm a social scientist. I've been working partly in government scientific advisory committees, more on the epizootic side. And I'm not a modeler, so that's the first thing, but I'm interested in the way in which knowledge and different kinds of issues get formatted within the policy environment. And of course, modelling is part of that, and a very constructive and important part of that. So I'd just like to start, and Gabriel's already talked about some of the history of modelling. We can go back to Ronald Ross, for example, and his understanding of the role of mosquitoes in the transmission of malaria, and of course the important interventions that he started to model, not the first application of mathematics and modelling to epidemiology, but one of the key ones. And then given the number of Australians on this project, also I should mention Frank Fenner, whose role in the experiments over myxomatosis, for example, in Australia, and the modelling of that process of susceptible and recovered or resistant rabbits was key in the uptake of some of the most commonly used types of models, the compartmental models that were of course taken up by Robert May and so on, and then worked through into some of the imperial models and so on that we've already heard about. So these are key, partly because I just wanted to emphasize that some social scientists are very suspicious of the use of these models because they come from ecological ways of thinking, if you like. And recently the historian Warwick Anderson, based in Sydney, said, what might be lost and what might be gained when human populations are remodeled as, he said, vermin? So we need to think about that. But the key is what might be gained and what might be lost. And I think there's some key issues here to think about. Very obviously, and just Epi 101 from a book we did a few years ago, Pathological Lives, and of course it's a key one for thinking. Of course, infectious diseases are relational. Everybody knows, I hope, on this call, on this conference, that there are a relation between hosts, pathogens and environments, and of course epidemiological models are really dynamic mathematical expressions of those kinds of relationships. The important point though is they are relationships, okay? It's not just the contaminant or the pathogen that's important, it's not just the spark, it's the fuel that is part of that forest fire. And I think that's where the social sciences are really important in thinking about the configuration of disease susceptibilities, if you like, not just the transmission processes involved. And that's a really key point that I want to keep coming back to. So some of the complexities around models, and I think Gabriel's done this very well already, but of course there are a whole series of models and thinking about complexities, and his graphics were really useful. I won't go into them in great detail, but we have the compartmental deterministic models, which tend to use heterogeneities, let's call them unknowns and variants, for example, unknown transmission rates, particularly early on in a pandemic, latency, age-related susceptibilities, fatality rates, and so on. These can be relatively unknown at different stages of the process and have to be allowed for in these deterministic models. Some of the stochastic models, the ones that deal with more chance occurrences, of course, produce a range of values which can be very useful to give you the kinds of error bars that we associate, or uncertainties associated with these models. Agent-based models can code for individual behaviors rather than using population kind of characteristics or norms. We can start to put in codes to determine or to model the ways in which particular individuals move around and so on. And then ensemble models from climate change, I guess, is running multiple versions of models to stress test them and so on. And of course, all of these things add complexity and sometimes reduce the efficacy or tractability of the results in terms of the policy world. So for example, there are these trade-offs, and Andrea Saltelli's work is really, and her colleagues are really important here in thinking about this. And there's a nice little infographic at the bottom there. Complexity can increase adequacy, as Gabriel showed very well, but you can risk propagation errors as well and make models inscrutable, or they become like a black box, difficult to, especially for policymakers and social scientists like me, to understand some of the processes involved. Simplicity, on the other hand, increases agility and transparency, but of course, as we've seen, can produce false precision. We can get the frog rather than the, or the toad rather than the butterfly, as Gabriel suggested. So a very useful infographic there from Andrea Saltelli. So I just want to talk a little bit about the social, and I guess that's why I'm here. I don't think it's just modelling at all. It's in policy terms, and I've noticed over a few years of advising on various committees, in policy terms and in modelling terms to an extent, the social tends to be formatted as something called behaviour. So we get this all the time in the UK situation, but I suspect elsewhere is that as a social science, you're drawn into talking about behaviour. That tends to mean what kinds of contacts are people making, what are their contact-related behaviours, and the estimates of compliance, and that tend to be how social science is formatted in these kinds of fora. And I really want to be emphasising that social science, of course, does a lot more than that, and there's a lot more complexity to the social than behaviour, and we don't want to reduce all human experience to these behaviours. One example we could take recently from the UK. One of our real problems has been over the susceptibilities and vulnerabilities of care homes. And I just want to sort of mention a few issues here around care homes. The issue, for example, and often we think in terms of processes and infrastructure when we're talking about the vulnerability or precarity of certain kinds of settings, and some of the things that I've listed there, one of the reasons that care homes became a particular problem in the UK, but also elsewhere, was the governance and management of those. We had thousands of providers, difficult communications, the cultural and practical norms around care and physical contact associated with care. And of course, this refers back to the modelling and understanding of the cultural drivers of transmission in the Ebola cases that we've had, epidemics in recent years. And then infrastructure, sector fragmentation, poor supply of personal protection equipment, inadequate buildings, poor pay, economic precarity, and particularly agency staff, which was a real surprise to the modellers, that the agency staff were moving between sites. And one of the consequences, I guess, of a decade or so of austerity in this country is that we have particular kinds of working relationships which make these kinds of structural drivers of transmission and vulnerability or precarity more important. And I should say we've got one of the largest avian influenza epizootics in this country, in my country, in the UK at the moment, and elsewhere, of course. And we've come up with very similar. You could actually use that list for the outbreaks on commercial farms in the UK. Very similar issues of poor infrastructure and so on. So it's more than behaviour. There's a lot more to these kinds of issues. We've done some work in Bangladesh, and I just wanted to mention that because I know lots of people in this hub are doing similar kinds of work of participatory modelling, getting people to kind of write down the kind of real drivers of disease and also antimicrobial resistance, and using some heuristic modelling devices with aquaculture workers in the bottom left corner there to try and develop these kind of more participatory models, which may be one way through some of this complexity and increasing the social aspects of it. So I want to end with a manifesto, go back to Andrea Saltelli's work, who recently published a manifesto last summer for thinking about all models, and this was about climate and dealing with waste, radioactive waste, all kinds of issues. But just a couple of things to highlight here, and then I want to add something to them. First of all, modelers must not be permitted to project more certainty than their models deserve, and politicians must not be allowed to offload accountability to models of their choosing. And we face this kind of suspicion and lack of trust in the UK in particular, when politicians argued they were following the science. And it really led to a kind of debate over, and I think modelers being put in really awkward positions by their politicians in this case. So we need to be really careful about what models do. They offer insights, as Chris Whitty, the chief medical officer in this country, has argued. So mathematical is a great way to explore questions. There are also dangerous ways to assert answers. Asking models for certainty or consensus is more a sign of the difficulties in making controversial decisions than it is a solution, and it can invite ritualistic use of quantification. And I think that's key. They are part of a set of decision-making procedures. So one thing that I would argue is that we need to get better at building diverse assemblies, going back to what the discussion we just had around the role, the policy environment. How do we build these diverse assemblies so that we get the voices of those, for example, in Bangladesh, who know about what's going on in their village, when it comes to poultry disease or anything else, but also the social scientists who may know about care homes and so on. So 4 quick points. We need a diverse assembly where insights, including model insights, are possible from a range of knowledge practices. These knowledge practices need to work with pre-existing hierarchies and without pre-existing hierarchies and without the burden of integration. So not all knowledge can be incorporated into models. Models, of course, can do a lot, but they can't incorporate all knowledge. The relational complexities configuring infectious disease are as important as dynamics of contamination. And then this is probably my key point, and one from the limited experience I have in the policy world, is that we may need a new mode of practice for expertise, from that kind of assured expert who defends their corner and their discipline to conditional spokespeople for specific associations. And they may be a virologist talking about her viruses in the lab to modelers and mathematicians and so on, talking about the propensities and abilities of models to provide insight, but also then sociologists and others who can talk about some of the drivers of vulnerability and so on to disease. I will stop there.
Thank you very much, Steve. I mean, that was a very useful contrast, although, I mean, I think you're both heading in the same direction, though, which is good. Let's just see whether we can tease out some of the detail and address some of the questions that we've actually received. I'll start off with one, and that's this, because models can actually provide answers or results very quickly, okay? And particularly when they're mathematical models. In an emergency situation, is that all we can do? Do we actually, because you mentioned diverse assembly at the end. Now, the problem with that is it will take longer to actually develop those models. And if you are dealing with an emergency situation, you don't have the luxury of that time. So what are your thoughts about that?
No, you're absolutely right. And in social science, we've had a movement for a few years to talk about slow science and the importance of building up knowledge and experience, often in local contexts, and working, to understand the specifics of a particular context, which is absolutely useless in many circumstances when you're dealing with a pandemic. It may help, for example, in a very localized outbreak situation where we can have area specialists coming in, but in a pandemic, we're often dealing with things that are social science hasn't evolved to necessarily offer quick answers to. I think all I could say is that it is, though, essential and incumbent on organizations, scientific advisory groups that Gabriel mentioned, to make sure there is that diversity of expertise. It may be clinicians, it may be people who know about the care industry in this country. There has to be a conduit so that they can talk about and raise questions. And it may be they won't have the answers, but they need to raise questions. I think there's been a tendency in the past to, like Andrea Saltelli says, that kind of ritualistic quantitative approach has tended to exclude certain kinds of knowledge practices and certain kinds of experience. And that just simply isn't sustainable. I think we need to do this to work at these device assemblies, but maybe they have different modes of operation depending on in emergencies and then in terms of thinking about rebuilding and so on. I think that's when they start to operate slightly differently.
Thank you, Steve. Gabriel, how would you respond to that question? I mean, and it's really, I guess, the diversity of issues that need to be considered when actually informing policy, and how can they be represented in models? Is that realistic? Can that be done and you've been at the cutting edge here, where information had to be provided very quickly to policymakers?
No, I think it can be done, but I think that, one has to recognize, first of all, how do you translate a policy question into a technical model? what can and cannot be answered by different types of models. And even before that, one has to sort of, from a public health viewpoint, coach and guide key decision makers what kinds of questions are the relevant questions. Then you have to identify from those key questions that would influence decision making whether or not they can be answered by models. And if so, then identify the right kind of model to answer that question, and then even more importantly, to interpret the findings accordingly and appropriately. So I think that it's very, very careful, wise, judicious application all the way through, from knowing what questions to ask, identifying which questions are amenable to being answered by models, specifying the right models, then interpreting the results appropriately, and then completing that feedback loop into helping decision makers make that decision in an informed way.
Okay, no, thank you, Gabriel. Thank you both, actually. A very good, I guess, I mean, the perspectives that you provide are very useful, very helpful. There's a couple of questions from the audience that they keep coming in, and there's one I'd like to ask you both, and maybe start off with Gabriel, and it comes from Tony Barnett, and he's asking, should modeling work require ethical approval? I'll start with Gabriel.
Well, I mean, ethical approval, well, first of all, I think that, the modern term for it is IRB approval. It's Institutional Research, Institutional Review Board. It's mostly, in the traditional sense of that kind of setup, it's really for ensuring that human subjects, or animal subjects for that matter, are treated right. In terms of the question, I think the underlying sort of principle or question really concerns, well, you know what, there are these cowboy modelers out there, or cowboy policymakers, who tend to politicize the whole scientific process and not interpret the data in the right way, or not specify the right types of models. They don't really know what they're doing. They politicize, so on and so forth. That, that really is about governance. That's not about having a professional, scientific, or ethicist panel to try to make up for the inadequacies of governance. Nothing is going to protect the population against bad governance. So I think that's, you shouldn't use a scientific process to, redress a deficit in governance. That's a out and out political process.
Thank you, Gabriel. Steve, you've got, what's your view in relation to this question about ethical approval for models?
Yeah, I think Gabriel's got it right. It is about governance. I think I'm less I less see the answer in a process of ethical approval than in thinking through. I think that what Gabriel talked about before, about that process of coaching and kind of making sure that this assembly that can deal with produce rounded scientific advice has the ability to not be hoodwinked or black box, not to treat models as a black box, which has been my experience, is that the models can sit on their own, be delivered, and then everyone else in the room kind of has to agree with it because they don't really get what's going on in the models or the principles behind some of the kinds of decisions. So I think that's a really important process of upskilling the various committees in order that they can take that skeptical approach to what they're being offered and add, therefore, to the utility of the model. I think that's key. So yeah, I think the ethical approach would be, or ethical approval would be for any kind of research. And I presume that the university committees that are involved in these models would be involved in that kind of process. But I think the key is that in the scientific advisory committees, that's where we really need the action.
Thank you, Steve. I've got, I mean, I'm just looking at the list of questions here. It's another one for you, Steve, and it's from Ivo Syndicus, and he's asking, I would be very interested to hear a little more about heuristic and participatory approaches to modeling that you've mentioned. Could you illustrate that a bit in a little bit more detail in a couple of sentences?
Yeah, I suppose one of the things we've tried to do with groups of farmers, for example, is talk about their sense of what risk is, what the kinds of burdens are. And I'll give a very quick example of work in Bangladesh, where the answer to, for example, the disease situation of farmers, these particularly around aquaculture, seemed to be that we could improve biosecurity and reduce disease transmission through better seed and that kind of issue. And that was to move them to a batch system. So that, you know, for a variety of reasons, that would reduce. And we showed that in our work with the farmers, that it did reduce disease. But the problem with the batch system, when we modeled it with the farmers, is that it increased their livelihood burden, because all their, in English, we say all their eggs were in one basket. Okay, that led to a kind of an increase of precarity in terms of risk. So that was one of the kind of examples where understanding their economic and livelihood risks was as, if not more important than some of the disease risks. So that's where we can start to add this into our understanding of what it takes to farm, what it takes to produce food sustainably. And that seemed to be, to me, a really good example of the importance of having different kinds of expertise, not just epidemiological or disease expertise, but also the expertise of the farmers who, after all, are running the farm. So those kind of models. So we added that into a kind of a non-numerical, but a process kind of understanding of the farm, and got the farmers then to work with what kinds of changes would be acceptable for them. So it was a kind of participatory process, not producing a kind of robust transmission model, but a model for change, I guess, a kind of a deliberative model in some senses. So it's a very different kinds of species of model in some ways, but a useful one nonetheless for that particular question.
Thank you, Steve. A question for Gabriel, and it's also on the, I mean, I've looked at various questions from the audience, and I'm summarizing a little bit here. One of them is in relation to the complex models versus the simple models. Because I mean, in your presentation, you talked about that, and and obviously the more complex, the longer it will take to develop the model, etc. So what's your feeling there? And you mentioned Google, for example, as one other possibility, the Google Trends type models. And where do you see the emphasis? Is it more on the simple models, or do you aim for complexity, or what's your benchmark?
Well, two principles. One is, it's not whether it's a simple or a complicated model, but it's the appropriate model. So I think that's principle number one. Complexity is a very bad proxy for appropriateness. Secondly, I think that all models should be made as simple as possible, but not too simple. Of course, I didn't come up with this principle. It's been applied in most of science for many centuries. So I think that those are the two bedrock principles. And I think that it's really too simplistic to say, oh, simple models are better or complex models are better, because there are so many different types of models. There are, I mean, really, if you think about modeling is simply just a formalized, systematic way of thinking. So just thought experiments themselves done by philosophers is a kind of modeling. It's an approximation of reality, organized systematically so that we can deduce principles or to deduce a set of predictions. That's really what a model is about. So I think that that's the kind of sort of mindset one should keep. And that's really all I can say, because it's not about complexity, ultimately. And secondly, about the time that is necessary to put together, say, complex models. A lot of pandemic work, say for flu, people have been doing, and building models just for, a flu pandemic for the decade before or even longer. So what everybody did when the pandemic finally came was merely just pull out an off-the-shelf model that they had developed prior to the pandemic and then seeded it or parameterized it with the reality of the beginnings of the first few hundred cases, let's say. And similarly, even for COVID, when nobody had actually modeled coronaviruses before, with the exception of the SARS-CoV-1 SARS virus, most people don't have an off-the-shelf model for that, but they adapted their, say, flu models to put it to good use. So I think that, you have to realize that it's really almost like the vaccines, where you have the platforms. Once you've developed the platform technology, it can be plug and play. Of course, I'm oversimplifying it, but that's really the kind of things that modelers do.
So really, I guess it's often about then existing models which have been validated and used.
Sometimes.
Yeah, particularly when they're complex. Okay, just another question that came from Bena Pearl Bongolan was about, and this is more applied. It's more about COVID. It's this question about what policy or what intervention to use, and she's asking, how do we prioritize vaccination? And the comment is her models say prioritizing the people that are moving around is more promising than prioritizing the elderly when it comes to future infections. But there's an emphasis on protecting or minimizing the number of deaths, etc. I mean, I'm sure it's a question that you've heard before, okay? And then to start vaccination with the elderly. Steve, do you want to start? I mean, what your view is in relation to that? I mean, there's an ethical element in there also, isn't there?
Well, it's interesting because yesterday we announced in the UK that we were putting another 1.8 million people on that vulnerable list in order to prioritize vaccination. And that was based on an algorithm on, the current understanding of the way in which the diseases move. So it was about prioritizing in particular ways and prioritizing the vulnerable. I guess this goes to a set of the government here are in a particular situation of making sure that we value all life, and in some ways, I think it's entirely reasonable that they do this. The long-term view, of course, is how do you prevent how do you start to manage down the pandemic curve, and that will, of course, be around mobilities and movements, and it will be different in different states. So in a country like the UK, where we're currently in lockdown, and the movement should be relatively minimal, then it makes sense to prioritize those who are deemed most vulnerable. In other states, maybe for example, in India, where you have high numbers of migrant labor, it will make sense because of the kinds of structural economic reasons that it's very difficult to manage that kind of movement downwards, then it may make sense to have different kinds of priorities. So I think it's very context specific.
Gabriel, anything from your end to add?
I mean, I think that, it differs from pandemic or from epidemic to epidemic, what you do. And, some strategies work in some cases, whereas they don't work in other cases. So, now we have the beginnings, it appears, of another potential Ebola outbreak in Guinea. And, the sort of multiple layers of ring vaccination worked very well during the most recent West African outbreak in those 3 countries. But it would never work in something like COVID. And that's really to do with the characteristics of spread and the mode of spread and the intensity and speed of spread between these 2 very different bugs. So, the clinical severity in particular risk groups and how high-risk settings are defined will determine what kind of vaccination priorities you may or may not have.
Thank you, Gabriel. We've got a few more minutes, 4 more minutes. So before I have to close the session, just one more question for Steve. You mentioned the idea of that we may need a new code of practice, and I've seen actually there are some publications where people are discussing the topic. But what would you envisage? Can you speculate? Can you come up with some rough ideas for modeling, for the use of modeling in policy development?
It's a really difficult question. I would go back to what Gabriel was talking about, that whole process of coaching. We are in this difficult situation where I think, and on the one hand, you have a group of people who will dismiss modelling as unrealistic and problematic, and those on the other hand who are in a situation of defending modelling. And sometimes I've been in certain committees where the room just divides very quickly between those who find they have to overstate what modelling can offer. So Gabriel's done a very nice job, of course, of doing that, being humble around the abilities of models and what models are for. And of course, that you can get very clearly from most modelers. But in scientific advisory committees, sometimes you get that situation of dismissal or overzealous ritualistic belief in models on the one, and that comes out, and I think that's how it's presented to decision makers. So I think we really need to do better, and maybe this is not just in the UK but elsewhere, around rethinking that. And some of the problem is that the ways in which other sciences get formatted and invited to the various committees, and then certain ideas get taken up, is because they fit better with that modelling mindset than others. So I'm very keen to emphasise one thing in my talk, and Melissa Leach and others have argued this point very strongly as well, is that this isn't about the integration of all knowledges so they all work together perfectly. There is, I think, a politics of knowledge here with a small p, that you have to accept that some things are not as easily modelled as others, but they're nonetheless legitimate kinds of knowledge and understandings of the experience that we need to be putting into the decision-making framework.
Thank you, Steve. I mean, it's quite nice really to finish off on both of you heading in the same direction, and there's a lot of compatibility between the ideas that you're presenting here. And I guess to add my own experience, the relationship, the science policy interface is very important. And it's one that you can't develop in a day. I mean, it's something that actually develops over quite a period of time. And different countries have had different experiences there. And COVID probably pushed a number of countries too quickly into a situation where the scientists then had to talk to the policymakers. So thank you very much. Let me just, we are almost, and we've got 5 minutes to go. So this has been a very good discussion. And I think hopefully we'll see what the views of the audience are, which we'll have a poll in a second. So please, I like everybody to join me in thanking our 2 expert panelists who've really, they've emphasized a couple of points, which we've got a slide of those points. And I'll just go through them one after the other. Let me put up my screen here. So the key take-home messages, and we'll also put them on the Slack channel, and also that you'll see them on our website. So number one, models are simply formalized quantitative ways of thinking through the complexities of reality. And models have many uses, not just predictions. And we've heard some very good examples from both speakers or panelists this afternoon or this morning in relation to the different uses. Specifying the objectives of a modeling study and interpreting its findings accordingly remain cornerstones of appropriate deployment and securing buy-in. So that's really also about the science policy interface, the relationship between the policymakers and the scientists. Models are efficient mathematical expressions of dynamic associations. That's their power, really. They are able to represent that relationship and simplify it to an extent. And to get the balance right here is important. The study of association is what also defines social sciences. We shouldn't forget that. Models are reality-based heuristic. Their effectiveness requires input from a diverse assembly of scientists and practitioners, and models support rather than bypass decision-making. The process of diverse assembly should not be displaced by a false sense of precision. And I mean, that was really emphasized by both panelists. So yeah, now for everybody in the audience, we would like your perspectives following today's discussion. Do please share your feedback on this, and it will disappear once you've actually voted. Thanks again to our panelists, Gabriel, Leung, and Steve Hinchliffe, for this very thought-provoking discussion. And also I have to thank our tech team that's working in the background and making sure that everything works, that the technology is functional, and I don't have to worry about that part. And also to the audience, we had a very actually over 100 people joining us today. Good questions came in, and do please continue these discussions on our Slack channel using the link you received at registration or accessed via our website today, tomorrow, or whenever you have time. Yeah, and we've got another event coming up. My voting panel here. So do we have the next event in this series will be on Wednesday, the 3rd of March, 2021 at the same time. Please join Professor Fiona Tomley as she moderates a discussion on the topic food systems and prioritizing people or poultry. And do we have a result from the poll? There it is. Okay. Epidemiological. So following today's discussion, I think that epidemiological models need to become a standard tool for policy development. At 14%, 1%, we need to reduce the influence of models. The majority we need to use models that effectively link epidemiological with relevant scientific, social science knowledge. And only 3% of people were basically sitting on the fence. So thank you very much, everybody. And yeah, stay safe. Thank you. Bye-bye.